All right, I see it says it's recording, so we'll go ahead and get going. All right, afternoon, guys. Thanks for taking time to hop on the call with us today. Um, just like we've done in the past, we'll go ahead and start with a review of the numbers and the data. So, Jordan, if you're ready, I'll turn it over to you.
All right, sounds good. Good afternoon, everyone. So yesterday we reported 156 new cases. There were 893 new cases over the past week of Tuesday, December 1st to Monday, December 7th. And the week before that, there were 949 cases. So we have seen a 5.9% decrease in cases over the past week. Our total number of jurisdiction-wide cases as of yesterday at 3 p.m. was 7,732. Over that time period, cases have been identified from school exposures, including colleges, household and community contacts, care facility workers and residents, healthcare workers, those attending social gatherings, including some Thanksgiving gatherings, religious services, recent travel, pre-surgical testing, and some other worksite exposures. Cases by county as of yesterday are Crawford had 379, Kalkaska 383, Lake 231, Manistee 439, Mason 681, Mecosta 1,350, with Ferris State reporting 509 cases, Misaki 321, Newaygo 1,847, Oceana 1,352, and Wexford 749. In the past week and a day, since we're reporting to you on Wednesday instead of Tuesday, there were 31 deaths and 779 people recovered. Yesterday, there were 15 positive inpatient cases at Munson Cadillac, 5 at Munson Grayling, 5 at Munson Manistee, 18 at Spectrum Health Big Rapids, 11 at Spectrum Health Gerber Memorial, and 10 at Spectrum Health Ludington. And Kevin also asked that I start to share with you all the same data that we share with our schools every week. So I am going to share my screen, and for those of you that aren't viewing on a computer, I will email this spreadsheet to Brett to send out to you all. So hopefully you are seeing my screen. So this data comes from the MySafe Start Map, which I included the link for on this first definitions tab here. And that gives you more of an overview of what some of these categories mean. I will go through those. So this allows us to see trends within the counties related to cases and testing, and it can be a useful tool for comparing one county to another. So first, we have the county risk level, which is determined by the number of cases per million or percent positivity. Right now, all of our counties are in E, which is the highest risk level because all of our cases per million are above 150 right now. The daily cases is the average number of cases per day over the past 7 days. The daily cases per million is the average of the number of new cases with onset divided by the number of people in that county and then multiplied by 1 million. So the reason they do this is to be able to compare all counties across the state, including those that don't have 1 million people like our own. So there you can see that Newaygo and Oceana have much higher daily case per million rates than our other counties, and the average across the district is 360.8 daily cases per million. Like I said before, we do this report for the schools. So the last report we gave to the schools last Thursday, it was 421.8 daily cases per million. So we are seeing a decrease in that. The cases weekly trend is either a negative or positive number. So a -1 means there has been a downward trend for 1 week. The daily tests, same thing as daily cases, the average number of daily tests given over the past 7 days. Daily tests per million, same thing as daily cases per million, except for tests. Percent positive tests sort of explains itself, but the number of tests that were positive divided by the number of tests that were given. So right now, all of ours are sitting above 10%, but it has decreased a little bit since last week, but hovering right around that 13%. And then the tests weekly trend is the same as the cases weekly trend, except for tests. So a 1 is an upward trend of 1 week. So increasing testing for 1 week. Are there any questions on this data? And again, it will be sent out to you in an email. All right, hearing none, but that's all I have.
Okay, thanks, Jordan. And again, I did ask Jordan to start sharing that information. Obviously, with the extension of the epidemic order, it was indicated the data points or the metrics that they are looking at. And so I wanted to, and I've gotten a couple of questions on what those data points might be. So I thought it would make sense that we begin to kind of share this information with you so that you can see it. As Jordan indicated, this is the data that we are providing to the schools on a weekly basis and helping to provide guidance to them off of. It's also the same data that we're utilizing with the courts based on, the criteria put in place by the Supreme Court in terms of what they have to meet in order to continue to move forward. So just wanted to share that with you guys so that you are aware of what that is and provide a little bit of an explanation for it. So Jordan will email that out. If you have questions, you can go ahead and ask me, or you're probably better off to send those questions to our epidemiologist, Jordan. So you can either respond back to her email, or I'm guessing Brett will send it out. So we'll make sure that questions or her email address is included in the email that goes out for this. So, okay, so that's the data piece that we want to cover. Obviously, it's some other stuff that we're working on. The extension of the epidemic order for another 12 days is out there and aware by everybody else. So we do continue to answer questions and provide guidance, and unfortunately have to deal with some of the enforcement pieces associated with that. That is continuing. Everyone has probably heard that CDC has changed the quarantine guidance there that is out there. And so now allowing the quarantine period to end after 10 days, provided the individual continues to monitor for signs and symptoms, and self-monitoring is allowed with that. And so, oh no, I forgot what I was gonna say about that. So, but so answering questions that go with that, we have moved forward. They did also include a 7-day period in there, provided negative testing is provided. Health department is not necessarily supporting that 7-day testing period at this time because we don't know. We know locally we don't have the testing capacity to do that, and the turnaround time to get tests, it ends up being 10 days. So, even though the quarantine period is able to be reduced to 10 days, CDC does still specify in that change that the 14-day quarantine period is still the gold standard and the ideal thing. So we will be, modifying our guidance in terms of, our workplace plan, workplace opening guide that we have, and some of the other pieces of literature that are out there. So it may take us a while to get all of that done. The other piece that kind of is throwing a bit of a wrench into this is the fact that the legislature enacted Public Act 238, and within Public Act 238, and this was signed into and put in place in October, and then made retroactive back to March. spelled out what the principal symptoms of COVID-19 are, but then it also stipulated in there that the quarantine period should be 14 days. And so now, CDC has changed their guidance to 10 days, but technically that law still states 14 days is what has to be followed. So this is I know it's being worked on at the state level to try and address this and adapt to it. But if you allow me to get on my soapbox for just a second here, this is one of the reasons why you do not legislate strategies to address a public health issue, because when things change, then it creates issues because you're not able to respond accordingly. You have to wait for other action to take place. So that's all I have to say on that. So, and then the other big piece that we do continue to work on revolves around vaccination. And I'm going to turn it over to Brett here in just a little bit to talk more on kind of our internal planning that we have been doing. But just a little bit of an overview. Dr. Morris did address some of the vaccine related questions on last week's call. We are trying to arrange for more of a vaccine update that she would provide based on questions that people would have. So if you guys have specific questions on the vaccine that you would like answered, if you can let us know what those questions are, we'll pass those on to Dr. Morris, and then those can be incorporated into her presentation. And what our plan will be is we'll have her do that presentation and then share that link out with everybody, so that you don't, if you miss a meeting, you won't miss it. You'll be able to access it multiple times. So again, if you have questions, let us know what those are, and we'll forward those on to Dr. Morris so that she can incorporate those into her presentation. Right now, we are still thinking, we'll be dealing with two types of vaccine, Pfizer and Moderna. Pfizer, it's expected, will be approved tomorrow. And so the state believes that the initial allocation of that vaccine may be here on the 15th. It's not as great as number as what was originally thought. Originally, we were thinking we were going to get about 300,000 doses. Now it appears more closely like we'll get 84,000 doses. So those groups have been prioritized, and I believe Brett will probably share that in his presentation, so I won't touch on that. And then the Moderna vaccine, I believe it's next week that will go for approval, and then we believe shortly after that, that vaccine will become available, and so we'll be dealing with those two vaccine types to immunize individuals against. And so I will stop talking about vaccine right now, and I'll turn it over to Brett. Brett, unless there's something else you want me to cover specifically about it, otherwise I'll let you address the rest of it.
Sure. So I've got 3 or 4 things to cover with you all. First thing I want to mention is that one of the priority groups is EMS. So one of the things that the health department is tasked with within our 10-county jurisdiction is determining who is going to actually vaccinate the EMS staff. And we have 3 options. So the health department can vaccinate them. We could provide them the vaccine and they could vaccinate themselves. And that's with the caveat that they would have to meet all of the MDHHS requirements to be able to do that. And then the third option is if the EMS organization is affiliated with a hospital, the hospital could say, no, we'll just vaccinate our own EMS staff. So with those 3 options available, we have to actually decide that. And what we've done to date is we had Dr. Whalen offer to work with the Munson system. So some of our northern counties have Munson hospitals. So he's going to work with them to make that determination and then let us know. And then Kevin is reaching out to Massaky County and Kalkaska County, both county administration and emergency management, to work with those 2 counties to make that determination. And then that leaves our other 5 southern counties in Region 6 that will have to make that determination too. So How we do that is kind of up to us, but my thought is if we have EMS agencies for Region 6, our 5 southern counties, on the call, because I know that like Mecosta County has their own, and then some of the other counties share EMS organizations. So it might be a matter of, even if the county wanted to do it one way, the greater EMS organization administration may say, no, we're doing them all the same, and this is how we're going to do it. So I'm just throwing that out there to say that that determination needs to be made. So we could probably come back around to that maybe at the end of this call, and those that are part of emergency management, county administration, hospital, EMS. If my thought is maybe we just stay on afterwards and we can discuss that again, particularly for Region 6. So that's one thing. Next thing is, I don't know if we've mentioned this on this call before, but the state is working with a couple pharmacy chains to vaccinate long-term care agencies. And so their intent is to vaccinate staff and residents of long-term cares. The caveat there is as long as it's within 75 miles of the pharmacy location. So if an LTC, for whatever reason, opted out of that, or they're outside of the 75-mile range, then that would fall back to the health department to make sure that we cover them with vaccinations. And there is, because you may hear about this too, there is some question out there of who they actually consider to be long-term care. So does assisted living and adult foster care and some of those entities fall into that group, or is it strictly LTC? We don't have a definitive answer on that yet, but obviously as that determination gets made, we will work with those entities to get them vaccinated as well. Next one is phases. So I'm sure you're all aware that there is limited vaccine. We're expecting allocations each week. So each week we will get a certain amount of vaccine, and it won't be nearly enough to do any of the phases, let alone groups within the phases. So there will be prioritization that will need to occur. And Kevin, correct me if I'm wrong, but the last time that I saw the preliminary phase list, I was told not to share that. So is that still the case?
Yeah, I think it's still kind of up in the air. I mean, we can, initially the initial group that we're looking at as of right now is going to be EMS, our hospital workers, so kind of the general medical floor, ED department, ICU staff, and then the skilled nursing facilities. Now, there had been some talk of looking at moving up like urgent care facilities into that group. But again, as Brett said, this is still kind of a living, breathing document. But right now, that would be our best guess for the initial group that would be getting vaccinated. And then obviously, once you get to tier 2 and tier 3, those are still some moving pieces. So yeah, it's probably better not to share anything and confuse people.
Yep. So with that said, as soon as that is finalized, we will make all our efforts through our various communication channels to get that finalized version out to you all so you can see what it is. But just real roughly, in terms of time frame, what we're talking about is the phase 1, like Kevin mentioned, is primarily healthcare type related staff. So we're looking at a month or 2 to get them done. Then we're going into like more infrastructure type, and it's going to be a month or 2 to get them done. And so I get this question a lot, is when are we going to get to, the general population? And more than likely, that's going to be spring to early summer before we actually get to that. And it has to do with the amount of vaccine that's available, i.e. our weekly shipments, and how long it will take us to actually do the vaccination itself. Because many of you may know there's a second dose that has to occur. So in effect, that will take us twice as long to vaccinate people because we have to give them a first dose and then 3 weeks, 4 weeks late. So 3 weeks for Pfizer, 4 weeks for Moderna, we have to bring them back to the same clinic and do them again. So if we're doing all of the first shot people for the second shot, we won't have time to do any first shots while we're giving the second shot. Hopefully that makes sense. So because of those issues, it will take us longer than normal to do our flu clinics and our flu vaccinations. Last thing I'm going to mention is early when we started this, when COVID first came out, our health department activated our incident command system. And then like early fall, we kind of looked at it as, well, this was our new normal. So we actually deactivated our ICS for a short time. Just this week, we activated again because of all the vaccination stuff. And I just point that out to say how we do that then internally is we have lots of staff on different teams working on different issues. So things like vaccination clinics or testing or communication. So I just wanted to mention that to the group that we are in incident command mode. We are considering this urgent/emergent, and we're pulling in staff out of their normal workloads to get them working on COVID stuff. So not that we weren't already, it's just we're ramping it up a notch. So then the other one that won't be me unless Sarah can't get on. I got a text from Sarah. She was going to talk about antigen rapid tests and how we were going to roll that out for our jurisdiction. So Sarah, were you able to connect?
Yeah, I'm on, and right now they're no longer hammering in the office. So
Okay.
if it gets bad, you'll have to take over. But we have received a shipment of antigen testing supplies at the health department, and our staff with the rapid testing, our staff were trained last week, and we are looking to roll out these supplies to local community partners, healthcare facilities, and other organizations that would be able to do their own testing in the case of an outbreak or staff exposure, etc. So we're putting that packet together. I am hopeful that we'll be able to email that out to the group by Friday. Brett's going to help me with sending that notification out to the group. It does require that your organization has a CLIA waiver. So you would need to already have a CLIA license to be able to do this yourself. And all that information will be found in the packet of information. Going to be starting with just an email to see who is interested in participating and getting a kit. The kits come in a box of 40, and that's all we're distributing at any one time. We do not know whether we'll get more test kits after the first of the year, but for right now, we do have some to increase access to testing for your needs. So I'm happy to answer questions on that.
Sarah, you might want to just mention, right now those tests that we currently have are good through the end of March. So if you are interested, let us know as soon as possible.
Yeah, and in response, it's better if you respond to the email that goes out, just so that it'll make it a little more easy to follow up on. I can tell you that the cost for a CLIA waiver is $180, and it lasts for 2 years. You're not able to test under the health department's CLIA license, so you absolutely need to have one. Our understanding is that most first responders, EMS already have a CLIA waiver for what they're doing currently. At least that's what we're finding. We're also making them available to the smaller AFC homes, HFA homes, assisted living facilities that have a capacity and have not gotten any testing kits from the state based on their size. So we are able to help out that organization too. That will be a separate email, and it has a separate process. But it does require that you report all tests to the state, so both positive and negative. And then if they are positive, you'll have to also notify the local public health department. There are guidelines on priorities for use of these test kits. We will have a log where you'll have to report where your tests were performed and on who and why. Kevin, am I missing anything?
No, other than as Sarah had indicated, this is kind of a mechanism that we were able to obtain to kind of help with some testing. Again, you know, our thinking being, you know, the schools and outbreaks that we may have in different locations, and then our EMS folks, and then also the smaller AFC homes. We kind of envision this being a nice thing that they may find beneficial. And so, you know, we don't know how long we may have these available for, or if we'll get restocked. But while we have them now, if it's something you're interested in, please let us know. Okay. Anything else, Sarah?
No, that's it. Email should go out by Friday at the latest.
Okay. So I think that's pretty much what I have in terms of an update. I don't know, Brett, anything else that you would like to provide today?
No, I think that was it.
Okay. Sarah, anything else from your end?
No, other than I think that Jordan has finished the county profiles, and maybe you said that before I got on. And so those should be uploaded to our agency website and should go out on the Gov delivery to all the contacts this evening, or at least a link to the page for your county data for the month of November. And all of the archived previous months going back to, I believe, starting with September are out there. Maybe August.
Okay. Sarah, are you able to share anything on the survey gizmo?
No, but Jordan might be able to. I mean, I can say that our plan was that we launched that last week. And so we're using an electronic notification system for those individuals who've tested positive and are uploaded into the state database who are not falling into the priority population, which is ages 24 to 64. And so we're doing a electronic notification so that they know that they are positive. There's a small short questionnaire where we're collecting some information on it and a link to some educational materials. Jordan I know there was a hiccup with a survey company last week, and so they actually didn't go out Monday. So it's probably too soon to give a real update as to how many people opened it, but Jordan probably can give a better understanding.
Jordan, can we put you on the spot?
Yeah, sure. So I think if I just had to estimate, I'd say that probably about 200 contacts have been uploaded, and I'm not sure exactly how many messages have been sent out of that 200 because we are just using a phone number that's listed for someone. So it is possible that that could be someone's landline number and not their cell phone. But when I looked this morning, out of that 200, I think there were around 60 responses so far. So I'd say that's a pretty good response rate. And hopefully we are collecting information that will be useful to us. As far as symptoms and maybe places and work sites that people have been to help determine more outbreaks and things of the people we aren't currently reaching, since we do have the new prioritization, as Sarah mentioned. I haven't seen any angry responses yet, so that's also a good sign.
And honestly, our goal behind this was to get people a faster notification of their results, and to get them to go into isolation and contacts into quarantine. So the goal is to really stop the spread. That's the intent.
Okay. Thank you, Jordan. Thank you, Sarah. Okay. Questions on any of that?
Okay, why don't we start with the chat box, and then for those of you who are on the phone, we'll also give you an opportunity to unmute and ask your questions as we go along. But to start with, our first one is just more of a statement for information. It says, this is Gwen Williams, says, "Hi, I'm not going to be able to stay on the meeting, but wanted this group to know that within a week or so, we will have the capacity for rapid COVID testing for people with symptoms who are healthcare workers, emergency service workers, or teachers. We expect to be offering this at the Shelby site, and I'll ask Jim Durham, who's the emergency manager, to send out a message when we're up and running with that. Also, we're still doing COVID testing for the general public at the Shelby Clinic." So then I gotta scroll down here. Okay, the next one is there somewhere we can look at the tiers for vaccination so we can see expected time frame for the vaccination of our AFC home clients and staff and our nurses who are doing injections in the field? So I think we already covered that. At this point, we haven't been given the green light to share the document that has the phases on them because they have not been confirmed at this point. So we'll have to wait a little bit longer to send that to you guys. Then what's the reason for the decrease in the number of vaccines we will receive? Is it an inventory issue? So Kevin, have you heard why it was originally free?
I have not heard a specific reason why. I'm sure it's logistics and how much they're able to get out and how quickly they're able to get out. We have been everything we're hearing is that once we do begin to get vaccine, we will continue to receive weekly shipments of vaccine, and so. I think this is kind of a hiccup hopefully this is a hiccup at the start that we'll be able to, to be able to work around.
Okay, and then I'll take this next one. It says, does EMS also include medical first responders as they are a part of the EMS system, or is it strictly ALS services? So the short answer is we don't know because we haven't been told that. But a couple issues that play into that is, one, they're trying to get people vaccinated who are first responders who have contact with people that might have COVID. So obviously we want to keep our first responders safe so they can respond to emergencies. So Brett's guess is that more than likely that's going to be included in that group, but I can't say that for sure at this point. The other piece of that is it comes down to logistics of actually providing the vaccine. We actually talked about this in our internal ICS meeting this morning, and that is, for example, does an EMS agency, would that include people like dispatchers? Even though they're not necessarily out in the field, if you don't have dispatchers or other non-medical people who are part of the system, should they be vaccinated at the same time? Because if we're, for example, and this is just an example, not that we would do it, but if we went specifically to EMS agency's office to vaccinate them, we might as well do the two, and this is Brett's opinion, we might as well do the two support staff as well. So that's really a non-answer because we don't have the answer, but I'm guessing more than likely we would. Okay, next question. What are the requirements EMS need to meet in order to self-vaccinate? I'll get that one too, Kevin. So
go ahead.
Okay, so what I was mentioning in my talk when I was talking about that is we don't know specifically. I mean, there's not a list that says make sure the EMS agency can do this and can do that and has this paperwork. But what I can tell you, probably what will come out is, for example, they may or may not need to sign up as a vaccine provider. They may or may not need to have freezer capability to hold the vaccine. So there are issues like that may come up. Another one is what staff they have available in terms of medical background to be able to provide the shot. There may be certain levels of staff who the state's going to say that person can't give a vaccination. So the EMS agency would need to have that level of provider on hand to be able to do it. those are the kinds of examples I was talking about when I mentioned that as long as they could meet those criteria. But right now, we don't specifically have a list of what they need to meet. So kind of to segue off of that question, when we're talking about trying to determine if EMS wants to vaccinate themselves or if they want the health department to do it, I think at this point, what we're looking at is if the EMS agency has the option to self-vaccinate, would they want to? And then we would put them on the list of, yes, they want to, and then we would follow up with the, okay, here are the requirements you would have to meet to be able to do it. If you can't meet those, you would just fall back into the health department bucket. Next one, is there a plan or process for dealing with allergies to the vaccines? I may be able to do this one too, Kevin, if you want.
Sure.
Okay, so a couple points on this is yes. So, for example, there are adverse effects paperwork that would be filled out for someone who actually has a allergic type of reaction to the vaccine. But then in terms of like for a lot of normal vaccines, for example, if you're allergic to eggs, it will say on the questionnaire, and then you may not be able to get the vaccine. As far as I know, there isn't a document out there for that. There could be, I'm just not aware of it, but there will be eventually. So we will get guidance on don't give a vaccine to someone who's allergic to eggs or has this condition or what have you. Right now, I just can't tell you what that is. And this just popped in my mind too. Another question kind of related to that is I've got questions about the second dose comes in at 21 days for Pfizer and 28 days for Moderna. I get questions about what happens if you miss your 21-day window. What happens? And just so this group knows that generally what happens with vaccine, you can't get it early. So we would not give it to you on day 19. You would have to wait till we get to the day 21. But generally, afterwards isn't as big a deal. So you probably would be able to get it on the 22nd day or 23rd day. We haven't been told that yet, but that's generally how vaccinations work. Okay, next question. Please speak to priority of vaccinations for Commission on Aging drivers, homemakers, case managers, Meals on Wheels drivers, and others who are having daily direct contact with individuals in the most vulnerable portion of the population.
You want that one too, Brett?
Sure. So this goes back to where do they fall in the phases?
Yeah.
So that group, all of those people you just mentioned, will be told to us when we can do them, and we won't have a say in it. And unfortunately, I can't tell you what that is right now in terms of what phase they currently have those types of employees in. So it's another kind of a non-answer. Yes, we agree with you that those people are at risk, but it's all based on the priority of people who are at risk that the feds have come out with.
Yeah, our concern really is we don't want to say something right now that may change and then you get angry with us. Which probably happens anyway, so.
Right. All right, I was scrolling down. I think this is the last one on the chat, and then we'll open up the phones. So if EMS decide to self-vaccinate, is there a tracking process identified for them to use or report to? And the answer to that is yes. There is definitely will be tracking. So things like MICR will be keeping track of that. We'll have vaccine/inventory tracking that will need to occur. Doses wasted if that were to ever happen. So yes, all of that type of information. So let's say EMS agency A says they want to vaccinate. We're told what the requirements are and they meet those requirements. So then we're going to provide the vaccine to them. that vaccine will come with all of that documentation on what they need to do, what forms they need to submit, all of that kind of stuff. Okay, so like I said, I think that's the last one in the chat. So how about anybody on the phone that would like to unmute themselves and ask a question?
No other questions?
So while we're waiting, Ken, if I could remind everyone that for those, particularly Region 6, but Region 7 counties as well, if they would like to, but if Region 6 EMS agencies and or hospital reps and or emergency managers who are on this call will stay on, we'll just give it a couple minutes for everybody else to clear off, and then we can have a EMS discussion.
And then Brett, if there's nobody on, you will follow up with those
Correct.
emergency managers, right? Yep.
Yep.
So again, as we work through the phases of vaccination, Brett did mention that, we're probably looking at spring, early summer when we get to the community, the general population in terms of vaccination. And really at that time, it will be all hands on deck. And so it'll be the health department, it'll be the hospitals, it'll be our EMS folks, everybody and anyone who's able to give a vaccine, will be kind of utilizing everybody we have and all of our resources to get the general population immunized. Okay. Other than that, just a couple reminders then. As Sarah said, there will be an email going out regarding the antigen test cards. Again, if that's something that you're interested in obtaining or have questions on it, you can respond back to that email and we'll try to get those taken care of. And then if you have other questions on the vaccine or related to the COVID vaccination process, please, email those to us so that we can forward those on to Dr. Morris and she can incorporate those into her presentation. And then once that presentation is done, we'll be able to share that link with everyone so that you can view that multiple times, and I'm sure we'll update it as necessary. And other than that, if there are no other questions, I think that's all we have for today. And so other than the EMS folks or emergency managers who Brett asked to stay on, I think everyone else is done, if there are no other questions.
Kevin, this is Vidra. I have a comment.
Okay.
I'd like to thank you, Brett, and your whole team for everything you're bringing to us. These meetings are very valuable to us here at Dial-A-Ride, and we really, really appreciate everything you've done. I want you to know that nothing you're doing is in vain, and I don't think you could do anything to make us angry with you. Thank you so much, okay?
Okay, good to
Thanks,
know.
Vidra. Appreciate it.
All right.
Yep, good to know.
All
right,
guys.
Oh,
Kevin, we did have one more in the chat box.
Okay.
It says, do you anticipate using CERT or Medical Reserve Corps? And is there a training for them if they are called upon to assist in vaccinating?
I mean, right now, I would assume we may be looking at any and all opportunities for resources, and I would imagine that there would be some type of training. I just don't know for sure right now. Brett, do you?
Yeah, I would agree. So I definitely envision using them at some point in this vaccination initiative. Not sure exactly what phase we would bring them in on, but definitely at some point I see them being used, and we would provide the necessary training that they would need to do the job.
All right. If there are no other questions, then at this point, everyone but your EMS or emergency manager folks, I think we're done for today. If you have questions, like I said, let us know. We'll plan to reconvene next week, Tuesday, back to our normal day. And other than that, thanks guys for hopping on the call today, and everybody stay safe and take care.
Thanks, everyone.